Hi, everyone. Welcome to our Stream Working Group virtual panel as the pre-conference day of Virtually CAHSPR. Given all the busyness around virtual means these days, we're going to give it 1 or 2 minutes for people to log in. And in the meantime, get comfortable. We're going to get ready for an exclusive, fantastic conversation. So we are already 27. All right, just checking last minute. All right, so I think we're gonna give it a go. So first, before anything, I want to begin by acknowledging that we are on indigenous lands. We need to respect the treaties that were made on these territories, acknowledge the harms and mistakes of the past, recognize the ongoing present-day colonial violence that is faced by indigenous peoples within healthcare, education, justice, child welfare, and governance systems, and we dedicate ourselves to moving forward in partnership in the spirit of reconciliation and collaboration. So on behalf of the CAHSPR Stream Working Group, but the CAHSPR community as well. That being said, before diving into our fabulous panel, maybe some housekeeping notes. So participants will be able to ask questions within the Q&A box at the bottom of your screen. The chat will be closed for the panel, so you can only ask your questions within the chat, the Q&A box, and upvote the questions that you would feel that are the highest priority, to which you would like our panelists to give some answers in the Q&A portion of the panel. You are allowed to and welcome to ask your questions both in English and in French. However, we will answer your questions in English, given the majority English-speaking audience that we have today. And finally, if you'd like to tweet about our panel, you can tweet about us, the CAHSPR SWLG, which is available at the bottom of the screen, and use the hashtag #VCAHSPR2020. And second of all, for the unfortunate who won't have the chance to attend our panel, this session is recorded and will be available in the Virtually CAHSPR YouTube channel that will be launched a few weeks after the conference. So without further ado, how are we going to lay out our conversation today? So we go in 3 times. While our panelists don't need introduction, I will ask them to give a bit of a profile about themselves. Then we were going to have topic-focused discussions on health services and policy research, career paths, and graduate studies in pandemic times. And then having an open question and answer period where you are welcome to write your questions in the Q&A box, and we will have our panelists dive in and give you their notorious perspectives on your interrogations. So without further ado, our fantastic, stellar panelists, as you can imagine how busy they are, so to take the time to have that conversation with us today, and trainees across Canada, I think we're very lucky and ready for a very exciting talk. So first we have Roxane Borges da Silva, which is our CAHSPR president and also an associate professor at the School of Public Health of University of Montreal. Then we have Dr. Alan Katz, who is our CAHSPR president-elect, director of MCHP, professor of departments of Community Health Sciences and Family Medicine at the University of Manitoba. Then Dr. Emily Marshall, who is a CAHSPR board member for a long time and also a scientific co-chair of CAHSPR for the past 3 years, who's an associate professor and affiliate scientist at the Department of Family Medicine of Dalhousie University. And then we have Dr. Jennifer Zellmer, who's a CAHSPR board member, a long-term partner of CAHSPR, and also president and CEO of the Canadian Foundation for Healthcare Improvement. So now time to talk for our panelists. So maybe we can start with in the order we just went through. So Roxane, in 2 minutes, if you can tell us who you are, your role and implication within CAHSPR, and your favorite quarantine hobby, because I know I'm in desperate need of some inspiration. So please enlighten us with your presentation. It's up to you.
Thank you. Thank you, Elizabeth, and thank you for this invitation. So you already told that I'm an associate professor at the Department of Health Management, Evaluation and Policy at the School of Public Health at University of Montreal. My background is in health economics, and I work in many research centers, but my research program focuses on healthcare organization and professional practice. About CAHSPR, my history with CAHSPR began when I was a student. I used to go to CAHSPR every year, and I was very happy as a student to come and to see so many research projects and so many mentors who were there. After, I was involved as the conference scientific co-chair during 3 years, and Denis Roy, who was the president of CAHSPR, invited me to become a board member. Finally, I became the elect president, and I'm now the president and at CAHSPR. About my favorite quarantine hobby, I don't know if I have a hobby. I work a lot since the beginning of the of the pandemic, so maybe to read. I like to stop and read a book. So that could be my favorite quarantine hobby.
Yeah, thank you. And while this is not very eco-friendly, I hope you read in hard copied books and get a bit out of your screen. So thank you very much, Roxane, for that introduction. Maybe Alan, you'd like to go next?
Maybe Alan is mute.
Yep. Okay. Can you hear me now? Thanks, Elizabeth, and thanks for inviting me, and for everybody who has joined us. Who am I? I'm a family physician by training, and I have been for the last 15 years active in at CAHSPR and as a researcher using administrative data at the Manitoba Centre for Health Policy. This is a center that uses administrative claims for health services and health policy research. And I've had amazing mentors there that have helped me work at the center, and I became director about 5 years ago. I have been involved in CAHSPR, as I said, for a long time, because I saw CAHSPR as the home of the work that we do in health systems and health policy. And I was very happy to join the board because I saw an opportunity to help CAHSPR grow and evolve with the times. And I feel that that I could support that and enhance the role of the organization over time. So that's been something that's been very rewarding for me as I've done that. I happen to enjoy a glass of wine every now and then, and have found a glass of wine or two with dinner to be a relaxer during the pandemic, during the isolation. The other thing that I feel very important for me is my exercise routine that helps me deal with my stress. But we've been exploring our wine fridge over the last 2 months and finding some interesting wines to enjoy during this time of stress.
Thank you so much, Alan. And I think if you don't already know, you'd be happy to know that more and more exercise are mixed with wine. So you have yoga wine and these. So I think this could be a very nice avenue within the next few weeks. So Emily, we're now up to you.
I'm muting myself. There we go. It's a pleasure to be with you all. My first experience with CAHSPR was as a postdoc presenting my PhD work for the first time at a national conference. So I'm a bit of an academic mutt. I am trained in health services research, anthropology, and epidemiology. So I do mixed methods primary healthcare research, not surprisingly. I have been on the CAHSPR board for the last few years, and this is my third year that I've been acting as scientific co-chair with the wonderful Dr. Matt Minier. And I also was previously the chair of the primary healthcare theme group. And I just wanted to share on a personal note that CAHSPR has really supported my career in many ways in terms of being able to network with people whose things you've read and you've never met them in person, but to actually get to know them as people and have them be interested in the work you're doing has been really helpful. Being able to share my research and get very valuable feedback and opportunities to then link up and do cross-provincial work with people who are interested in the same kinds of questions. And learning from others. And also the opportunity to have some roles in a national organization has been really wonderful for me. So I highly urge you all to stay connected with CAHSPR because it really is a very supportive group. In terms of my favorite quarantine hobby, other than snuggling with my dog and my husband, I suppose, is I paint. And I don't know if you can, it comes through on the screen. But anyway, I love to paint, and mostly with watercolor. And so when I get some time, which isn't always very frequent, I love to paint.
That's wonderful. Thank you so much, Emily. Hopefully someday we'll see one of your paintings published as well, beyond all of your fantastic work. And thank you for introducing how much CAHSPR has been significant in your journey from being a trainee. So a little shout out to trainees who wants to get involved. And then we have Dr. Jennifer Zellner, if you'd like to talk a bit about yourself.
Thanks so much, and thanks to everyone who's joined us today. Who am I? Well, I'm currently sitting in Ottawa, the traditional unceded territory of the Algonquin and Anishinaabe peoples. And I've come to Ottawa through a variety of paths. My academic training was in mixed, like Emily's. So my undergrad training is in health information science, and my graduate work is in economics. So a bit of a combo there. And I currently, as Elizabeth said in the introductions, work for the Canadian Foundation for Healthcare Improvement, and my academic appointments at the University of Victoria, which manages to confuse CIHR and the people who try and organize geographic distribution of panels and so on quite nicely. My role within CAHSPR for me has always been my academic home, the community of people who are doing work that was like what I was interested in, and also the community of people who are using some of that work. So the combination of intersection points. You know, you always know when you go to a CAHSPR meeting that you'll run into people who are doing interesting things and be able to set up new ideas for collaboration and think about how you might go forward. A number of years ago now, I was appointed editor-in-chief of healthcare policy, and with that came also a role on the CAHSPR board. So I've been on the CAHSPR board for quite a while now, and it's been fantastic to have the opportunity to contribute also to the governance of the organization. My favorite quarantine hobby, I have a lovely niece who has me firmly wrapped around her finger. And so we started early in quarantine that she and I would FaceTime when her mom and dad were on different conference calls while they were working. And so continuing that and then finding things to do together virtually has been, I think, an interesting journey in quarantine land.
Thank you so much, Jennifer, for that presentation. And just want to share I have to learn to spend much more time with my niece in the past few weeks. Unfortunately, I discovered how I was behind from her in terms of virtual and technological means. She's 9 and she's way above me. And thank you all for your presentations. I think that it's pretty wonderful to hear the word home as much when talking about CAHSPR, and not to quote you, Emily, but I think we've seen all of the work in advocacy around family bubbles, community bubbles that are currently creating across Canada. And if CAHSPR feels like one of those bubbles for the health source and policy research community. I think just there we have a wonderful success. And the availability and implication of our panelists, I think, is a result of that, especially regarding the support towards trainees in these difficult times, where a lot of questions are raised by trainees. As the student working group, we got a lot of feedback from students, from undergrad to masters to doctoral to postdoc, asking if we had any advice or any evidence on how career paths and graduate studies are going to get redesigned throughout the years as a response to the COVID-19 outbreak. And so without further ado, we will have for the next 30 minutes, 2 topic focused discussions. So first one on COVID-19 implications for career paths in health services and policy research, and then COVID-19 implications for health services and policy research priorities. Those were selected, again, building on organic feedback we got from trainees across Canada over the past few weeks. And how it's going to work is that we're going to have a panelist lead to launch a conversation. So we're going to have a 50-minute conversation per topic internally within our panelists to get their complementary perspectives on that. And afterwards, we're going to have that open Q&A sessions where you can ask all of the questions you dream about asking to these kind of high policy leaders while concluding the panel. So let's start with our first topic. So COVID-19 implications for career paths in health services and policy research. And I will invite Professor Roxane Borges da Silva to start the conversation. So we are listening actively.
Thank you, Elizabeth. So I presume that most of the participants are graduate students or PhD students in health services and policy research. So I just want to make you think about a point. When we think about research in health services and policy, I think we always, or maybe we forget too often, public health. So with the pandemic, we thought that public health was very important, and maybe there are not enough money in the budget for public health. And we understood too that we need expertise in health system or care system for sure during the pandemic, but we also need expertise in public health system. And what I mean in public health system is about managing and organizing public health in this type of context like pandemic. So this is I think a very an emerging point and a new way of thinking health services research and health services and policy research. We have to put in public health, and not only healthcare organization like hospital or primary care organization. It's very important in the context of pandemic. So it may be a way to reorient or to think about when you are thinking about your career and your next maybe studies or graduate program you want to go or to register. That's my first point. And I wanted to tell about also some competencies or some skills that maybe we have to develop when we want to work in healthcare system when in the context of pandemic. And I'm just going to put some expertise, and I would be happy that my colleagues complete. And I think about risk analysis. I think about information system management. In Quebec, we had many problems in managing the data, managing all the deaths and everything. It was so difficult to have the good information for researchers, but also for decision makers. The prime minister didn't have the good data, so it's a big problem. And in some regional public health direction, they still use the facts, and they still use paper and pen to collect data. So I think we have to move up from 1919 to 2000. So we have a big issue about that, and maybe lots of careers that could come in this domain. So I will leave place to my colleagues because I could talk a long time about that.
I'm going to jump in, seeing that nobody else is. I don't know if you can hear me.
Yeah.
Okay. So I think that Roxanne has just hit the nail on the head with the importance of public health as being the key thing that we learn out of this pandemic. Clearly, this has been a public health, I'm going to say in some respects, disaster, because it has been. We were not prepared, and we should have been prepared. We've been speaking in Canada for a long time about the pandemic that was coming. And then in 2008, after 2008, we got complacent because that didn't turn out to be the big pandemic it was supposed to be. And as a result, we just stopped preparing. So public health needs to evolve, and that's a huge opportunity. The other opportunity, I would say, is that there has been a sea change in how care is being provided, particularly in primary care, at this time due to physical distancing. So the dominance of virtual care in the primary care realm has opened huge opportunities for health services and health policy research. We need to understand how to do this to its maximum benefit. We need to understand how the public perceives it. We need to understand how it needs to evolve over time to address the needs of Canadians, which I guess is my third point about health services and policy research that this pandemic has taught us, is that our healthcare system itself needs to evolve, not only in the context of virtual care and public health, but we still have a healthcare system that was designed for the 1960s, and there's lots of room for research to support policy for the evolution of our healthcare system into the current century, as was pointed out by Roxanne.
I can tag on to that, Alan. I agree with all of the comments so far. And when you talked about public health, it reminded me actually of a few years ago. I think Andre Picard was one of our keynote speakers at CAHSPR, and he gave a whole talk about how if you actually put a gun to the head of a policymaker and said, where are you going to put your money that's actually going to make a difference in the population health, 10 years from now, we wouldn't necessarily be putting it in another MRI machine, but we'd be focusing on public health and the social determinants of health. And so that just reminded me of how sort of very clearly articulated that argument was then. And I agree with you. We have so much more to learn about how we support public health. The other concern related to the availability of healthcare for me has been the rise in the private for-profit sector, taking advantage of gaps in ability to access care. It's been going on for some time, but I think there's been an acceleration where you've had huge companies like the Loblaws chain offering free service access to Maple, so you could talk to a physician to get your prescription and then get it filled at the store. So for me, I think that's a big threat to our universal healthcare system. And then I just wanted to throw in something positive, because we all need a little bit more positive these days. One other implication around COVID and implications for career paths is science has never been sexier, and people have actually heard the word epidemiologist, and a lot more people know what it even is. So the value of scientists and related fields has never been more appreciated, I think, by the populace, and I think that can only bode well for future support for health research. And so I will sign off on my comments on my little wishful, hopeful thought.
So maybe I can add to Emily's wishful, hopeful perspective before we get into the challenges. And I think it's also true, and Alan, you kind of started with this as well, that there's some tremendous policy windows that are open right now. Some reconsiderations of the ways that things have been for a very long time, some openness to look at completely different approaches than we might have considered in the past. And, I agree with you, Emily, there's a hunger for information and science in that context. And so, many of us got involved in health services and policy research because we cared about making change happen. We cared about better health care. So the fact that those policy windows are open, the opportunity to contribute to them, and to contribute to them in a way that you can bring that evidence forward and really see the opportunities for that to change things quite quickly is phenomenal right now. Now, those policy windows won't be open forever. And so there's interesting challenges, if I segue maybe into the next part of our conversation around, how do we think about how to use the bank of evidence that has been built up over years to inform some of those discussions? How do we do rapid work that will help to inform it as well? But also, how do we be honest about the fact that in many of the areas where the health system and public health have been most challenged, those are areas where there actually hasn't historically been a lot of research. So there's not necessarily an investment in the information infrastructure, to Roxanne's point, in some of the base of knowledge that would allow us to move as quickly as might be optimal right
now. I think, and I'm confident to speak for all participants, that this has been wonderful, so informative. I have 4 pages of notes. As a trainee, used to, and I'm still used to using pen. I think this is terrific to have that focused conversation around public health. And I can just personally share that I have a master in public health prior to my PhD grad studies right now, which is professional. And before the pandemic, every time people ask me, what did I do in my master's? People were like, okay, public health, what is this? And now it's like, you did a master in public health, and you can see that value. I think also that it's not only about, as you said, having science never been sexier and having that hunger for science, but also sort of showing in a very transparent ways how it's hard to get good science done quickly. And so people are hunger for data, for information, for guidelines, and it's taking a long time. And I think populations across Canada and maybe around the world are getting more familiar with, okay, but if we want something that is secure, that is valid, that is strong, we need to be patient and acknowledge that work is done behind the scene. Yeah, definitely. So that was terrific. I think we can move on with our second topic area, which I'm sure will trigger another wonderful conversation. So COVID-19 and health services and policy research priorities. And I would invite Dr. Emily Marshall to start the ball, and then have other panelists jump in for the next 15 minutes.
Thank you, Elizabeth. I will start off, but as I'm sure many people will have thoughts to share, and I'm sure there's lots of wonderful questions out there. I think the first thing I'm going to say is that, yes, COVID-19 has really impacted health services and policy priorities, but it's also evolving. It's been evolving since COVID emerged, and it will continue to evolve in lots of ways, some of which we can anticipate and some that we can't. As an example, back in February, the World Health Organization published a blueprint from a 2-day forum that they held around their priorities around COVID-19. And they talked about the priorities being just gathering the state of knowledge, identifying gaps, and identifying and fund priority research to stop this and future outbreaks. And they included some of the things you might expect around natural history of the virus, transmission and diagnosis, epidemiology, clinical studies, infection prevention and control, therapeutics and vaccines. But notably, they also included ethical considerations and the integration of the social sciences. And in contrast to that, on April 23rd, where we've actually had some more time to reflect, the US National Institutes of Health released their strategic plan for COVID-19 research priorities. And there were only 4 themes that emerged, and they were epidemiology and surveillance, diagnostics and assays, the development of therapeutics, and the development of vaccines. But luckily, I think the Canadian picture is a little bit more holistic in the approach already. So we've had 2 priority calls at the Canadian Institutes of Health Research for COVID-19 related research. And in that first call, we had about $18 million of that funding went to support the areas of studying the public health response, the social dynamics and communication and trust related to COVID-19, and coordinating government and logistics. And so those categories of funding accounted for almost 1/4 of the funds that were distributed during that competition. And it'll be interesting to see with the second competition currently under review, what priority areas will get attention in that. But I think there is this evolving aspect. But also, as you consider your place and your research, I have a few key messages that I sort of thought were important. And the first is that while COVID-19 is an essential priority right now, it is not the only thing that still matters. And so if you have questions about other things, they still matter. And there will be opportunities to focus on those as well. And I think the opportunities for non-COVID specific research will reemerge. I think there's also ways to align current research to address the new COVID-19 context. So in that most recent call from CIHR, one of the emphasis that they put out was that they wanted existing teams who were already working in the area to be able to pivot their work to add in that context. And so I myself led one of those grants that's in submission. And I think a lot of teams are trying to figure out how can we make our work relevant in a new world with this new context, but build on things we already know and know how to do well. We also are going to have some newly emerging teams. And so this is a message for students. I think that these new teams are going to be tasked with trying to do things in a more rapid way, which we know is challenging in research, but there may be opportunities for to join teams, and you could potentially even build in your own research question and tag that on to a team that gets funded. So it's important to try and get connected to what's going on and what gets funded. And so look at the announcements when they come out and see if you have connections to connect with those teams. I also think that there's going to be evolving priority areas, and it can be really valuable as a student to kind of take a look, do some searching online, see what the health authorities, the provincial governments, the provider and patient organizations and community organizations are saying about what are their emerging priorities and what questions would they like to be able to answer that with those. And then the last thing around that evolving priority areas is, for those who aren't aware, there is a federal network called the CAN COVID network on a platform called Slack. That has almost 3,000 members from the research community across the country. And then there's different themes. So I am the moderator for the theme on primary healthcare research. And there's communication within those teams around, I'm interested in doing this, as in other provinces that want to join my team, or people offering up their services in terms of skill sets. And I know that being a moderator, I go to these meetings, and there have been projects that have been sort of priority areas that have emerged from researchers that have gone up the line all the way up to Dr. Tam and the people at the federal government to consider, and also they filter their questions back down to the research community. So I would recommend getting involved in that community. And lastly, as a health services researcher, I also believe that the most important lesson that is emerging from COVID-19 is that the health and well-being of all of humanity is inescapably linked to how well we support and care for all human beings. And I think this may lead, I hope this will lead to greater focus on equity and the social determinants of health, not only in our own backyard, but also globally. And I think that those are some directions I think we're all gonna have to move towards in this new COVID-19 reality. So I will pass the gauntlet.
Amen to that. What a difficult act to follow.
Well, I had 24 hours to prepare.
Yeah, I love what Emily's suggested there. She's really covered a huge amount of material, and I think that, you know, the concept of talking to students about this, I think as a student, you need to keep your options open. You need to keep your eyes and ears open, as Emily said, see what's going on around you, look for opportunities, connect locally with your mentors. And so let's talk a little bit about that, because I think practically students are in a real disadvantage right now in that they're not rubbing shoulders with their mentors the way they used to. You're not going to classes, you're not in the building, you're not going to presentations where your colleagues are presenting, maybe defending their projects or something along those lines. So there's very little opportunity to rub shoulders with people. You're unfortunately quite isolated, and I've heard that from students. And each, I think, school is trying to find ways of bringing people together with weekly student meetings or things like that. But even then, if you're meeting with other students, that's not an opportunity to rub shoulders with mentors and the people who are doing the work. The reality is that those of us who are writing these grants are always looking for researchers to join our teams. We want you there. So that to me is something that we need to find a way of ensuring the opportunities are there for you to interact better with your mentors. So each of you have at least your committee, your supervisors, and send an email to your supervisor and say, how can we meet? Not necessarily about my project, but I want to be part of something bigger, and I want to have the opportunity to not get lost in the shuffle of physical distancing and being out of sight, out of mind. I want to be part of this, and I think that's an initiative that so many of us would more than welcome. We really feel, I feel that's missing, and I know many of my colleagues do. So I think that builds a little bit on what Emily has said as an opportunity that exists, and we need to explore that. The other thing I would say is that we each have our own interests, and just because we've got a pandemic doesn't mean your interests aren't important, which once again is something that Emily alluded to. And I think that you will find a way of exploring your interests within stuff that's being done in a broader context. So stay true to what you are interested in, because research is not an area where you get instant gratification. It's a marathon, not a sprint. And so to stay in for the marathon, don't sign up for something if you're not really interested. If it's an opportunity and you're thinking, well, I'm not sure, maybe that's not the right thing for you. Maybe wait for the next opportunity to come along, because I think this is a marathon. And yes, did I have any clue when I started my career that I would be doing the things I'm doing now? Absolutely not. So opportunities came along and I thought, should I do that? Yes, I went in a different direction and that worked for me. So I'm not saying don't go there. I'm saying be adventurous, be prepared to fail potentially in an area that you think you might be interested but are not. But at the same time, if you don't feel it's right for you, then probably it isn't. So this isn't really about research priorities. It's about how to get more involved in the things that are out there. I can change the topic. I'm talking right now. Nobody's going to shut me up, I don't think. So I really feel that there's lots and lots of opportunities. And the one priority that I think hasn't been highlighted, other than in what Emily said about CAHR, in the previous question, we spoke a little bit about how that there's a hunger for information and science. And all of you are growing up in an era where knowledge translation is recognized as being important. And whether you call it knowledge translation, knowledge exchange, there's multi-implementation science, they're all linked. They're not exactly the same necessarily. But what I've seen in the COVID pandemic era is outstanding communicators who've done an amazing job of expressing themselves to the public, to their publics. I'm talking about public health providers mainly. And I've seen some communicators who haven't quite gotten it right yet. And I think there's a lot of research to be done in how we communicate around public health and health research and science. And I'm very excited that as an opportunity to move forward on that. I'm going to stop there. Thanks.
Maybe I'll jump in and follow on Alan's comments, which are also difficult to follow, just as Emily's were, and take Alan's privilege of taking the conversation in a slightly different direction, because I think, Emily, you did a really amazing job of laying out some of the topic areas that are of interest and where some of the possibilities are, and Alan, you added on to that. I actually think that one of the biggest priorities for us as a community is going to be to see how do we add value and not noise. You know, there's already 10,000 articles that have passed through PubMed on COVID. That doesn't include things on preprint servers. That doesn't include things that are still on somebody's laptop and haven't been sent anywhere. That doesn't include anything that would come out of all of those grant proposals that were just written and sent to CIHR. So I think as a community, and you know, I think, Emily, you highlighted the CAN COVID group. There's COVID End as well for those who are doing more knowledge synthesis type work. How do we actually think about leveraging the global research enterprise, in our case in health services and policy research, to really get to the answers to the questions that are important? Because there is a huge amount of capacity that we collectively have, but there's also a laundry list of really important questions that we need the answer to, and that the pandemic, you know, if we put the silver lining on it, there's any number of natural experiments to be able to study, whether it's communication styles, whether it's approaches to public health, whether it's things in the health system, whether it's equity issues. So how can we as a community really think about making the best use together and not ending up in the situation that we did in some of the early days of, you know, there's got to have been 1,000 rapid reviews of N95 mask reprocessing. And many of them were good, but there were lots of other things that also needed to be done at that time.
Okay, I'm going to jump in. I just want to emphasize about the role and the involvement of students. I just want to tell about my story. When the pandemic starts, I was very surprised that I was very popular in the media, and I did maybe 2 or 3 media interview every day, and it was very lots of media interview, and lots of people saw me. So, and I received many emails from students, and I can tell you about 2. 2 of them wanted to work with me and were very interested in my work and research program and research project, and now they're working with me. So I just want to tell students, don't hesitate to write the researcher. Find his email address on the website of the university. Send him an email or send her an email and propose. You can, maybe there is a place, a room for you in the team of the researcher, as a research assistant, or maybe as for a future collaboration as a supervisor. Don't hesitate to email the researcher if you feel that you'd like to work with this person, or you're interested in his research work. And I just wanted to come back on the COVID-19 outbreak, and Elizabeth asked us if we how could we redefine health services policy and research priority in Canada with the COVID-19. So I just want to come back on that point, that the COVID-19 outbreak clearly revealed sorry for my accent, the flaw, the breach in our system. So, for example, in Quebec, we experience very bad issue with long-term care. I think in Ontario it's the same. So, you know, there is an opportunity to work on that and to develop projects on that, and to improve care organization and maybe health services and policy policy about long-term care, for example. So we have to be aware and to listen what's going on, and to be flexible maybe, and to be able to change our mind and to work on other projects, or to just change a bit our research question, to integrate some new issue or some new content in that context of COVID-19. And I know it's difficult, but maybe it will be very helpful for decision maker and for the society. Your mic is muted.
Yeah, thank you so much. This was a crash course really on how to be meaningful in anticipating careers and graduate studies in health services and policy right now. And I did not say health services and policy research studies because I think that from our panelists' profile and perspectives, more and more cross expertise will be sought for rapid and valuable research application, data generation towards learning as a communities, as a health system across Canada, and not only as research units. And I just want to remind the audience that we have 14 minutes exclusive with our 4 wonderful panelists. So if you have any questions, ask them in the Q&A. I think our participants are stunned or having cramps taking notes. We don't have any questions per se, so I will very privilegedly, if it's a word in English, ask one. We did a bit of a Twitter chat within the next 24 hours, interrogating our CAHSPR student and trainee community about what would be the main opportunities and challenge brought by the COVID for career preparation, and what would be the research priority. And some of the feedback we got is that there is a lot of concern and interest in pushing the health services and policy research agenda towards valuable research, towards valuable health systems. However, there are concerns about the traditional academic performance benchmarks, which I would think our panelists are a bit aware of. And I think that the latest CAHSPR grant competition showed how much people are into research for good reasons. However, it can be very demanding, a bit going beyond the reasons and the value that researchers are aiming to generate through their research projects and quality improvement initiatives. So my question would be, how can we, as the current trainee community in health services and policy research in Canada today, influence these traditional academic performance benchmark towards, as Jennifer said, adding value and not noise for better health systems? And I would just leave it for all of you to jump in maybe on that question.
So Jennifer sent a text saying this is for somebody in academia. Nice pass in the buck, thank you. There are 3 of us in academia.
Anytime, Alan.
And I'm happy to jump in because I think the question is an important one, and it's one that
Oh, sorry, Alan, we seem to have lost your Alan, we cannot hear you. Can you hear us? Oh, okay. I think it went out for about 5 seconds. So sorry, but if you could maybe go back to what you were saying. We missed you for a couple of seconds there.
Yeah, I apologize. My internet is unstable. I just got that message. So if I disappear again, let me know. So what I was saying is that our research unit's goal is to influence policy in Manitoba, where we are. And as a result, we spend a lot of our time working with policymakers, understanding what their agendas are, and communicating our results to them, which that work does not get academic recognition as a rule. Reports that we write for government are not publications in the sense that, well, what kind of a journal is that published in? How many readers does it have? What's the impact factor? And the time and effort that goes into building relationships with policymakers is a huge amount of work. And yet that is essential work if your research is actually going to bring about some policy change. So I'm not sure that students are empowered to actually bring about that recognition that you're talking about, because we as researchers struggle with it too. But I do think that there's been a huge change with the Health System Impact Fellowship competition and role that CAHR brought in about 3 years ago now. So Health System Impact Fellows there are over 100 of them in the country now. They're funded by CAHR. It's a combined program between CAHR and the system that the person is going to work in. And these are often regional health authorities, provincial departments, even university departments in a unique role. And the opportunity there is to get into the policy realm and marry research with policy. And as a result, you come back to academia if you choose to, with an understanding of policy and how to influence policy. And if you stay in the policy realm, you bring your research skills there. So I think that this to me, you know, if you read the vision and objectives of CAHSPR, CAHSPR is supposed to be a dynamic environment which brings together researchers, the public, and policymakers. So this is exactly what we are trying to do. We are trying to do this initiative is bringing us together with policymakers, which hopefully allows us to get recognition within the traditional academic world at the same time. I think we're getting there, but I would say the answer to students is that's not necessarily your battle. I think it's the battle that your mentors should be fighting for you.
Alan, I would just add, I agree with everything you said, and it is so important. And then we've gone a long way, like doing research that now involves patient perspectives and the perspectives, having policymakers on your teams. Like these are sort of now very much expectations around your grant submissions to CAHR. But you're right that there is less recognition in the academic system for promotion and to keep your job if you're not doing all these other pieces. But I will say I was a part of some of the CAHR strategic planning meetings that have taken place over the last year, and there was a real discussion and acknowledgement that this is a real challenge, and they want us to work with patient partners, but they need to better support our capacity to do so. They want us to work with knowledge users, but they need to recognize that that involves a lot more time and effort. Like the number of additional ways that I run my data analyses and put reports together that are broken down by zones and networks so that they're relevant for my province is really time consuming, and it's hard to get enough funding to do all that work. But there was a recognition, but one of the things CAHR said was it's one thing for them to ask you to do that work, but it's actually going to be the universities and working with the U15, they call them the 15, sort of more research intensive universities in the country. We need to help the universities figure out how to change what is valued in the system and how they assess their faculty. And I think that is something we all need to sort of emphasize as being important. It is a battle we as faculty need to continue to fight, I think.
Thank you so much. I think this is, as a trainee, I would just share that I feel it's very soothing to feel the other way around, like we're giving you homeworks for once, but it's not about that. I mean, it's definitely a collective fight. Everybody's and researchers right now and policymakers and community leaders, and foremost the patient leaders are definitely at war for several years right now. And just because we are about 6 minutes into the end of this fantastic conversation, we did have a question from an audience member, which I will share right now. So the panelists had great suggestions about how trainees can proactively get involved in COVID-19 research and find opportunities. But this puts a lot of weight on the shoulders of trainees who may be vulnerable or overwhelmed right now. what do the panelists think could be done at an organizational level? So university, research networks, CAHSPR, CAHR, Pink Canadian, non-for-profit organizations, to support trainees right now and avoid losing a generation of young researchers during this COVID-19 crisis?
So I typed a brief answer to that. I think that one solution, I think that each university needs to work on this, but I would also suggest that this is something potentially that, and I don't want to give you more work, Elizabeth, but I think that the Student Research Interest Group can potentially play a role here in being that bridge between the CAHSPR members who are researchers and the CAHSPR members who are students. So traditionally at the face-to-face conference, we would have that speed dating or some other mechanism of doing that. That we can't have anymore, but let's try and think outside the box and create some sort of drop-in session maybe, where we can all come to a Zoom meeting and see what people are interested in talking about. I think it's a really good question that we need to take seriously and find a way of addressing.
I keep tagging on to you, Alan. I just want to add, so I grew up with university professor parents, and so I had the privilege of not feeling frightened of being open and talking to faculty. And I realized what a privilege that was. And I just want to make it very clear to all the students, everybody is finding things challenging, and it's a bit more of a struggle every day to figure out how we're doing things and what we're doing. And there's personal burdens as well as professional. And please feel free to reach out if you have a committee member or somebody else at your institution, and to your friends and your family. There are also supports. Every university has student supports available for mental and emotional health. It's a really important time to be able to acknowledge where you're at and seek help and support, because I think everybody would understand. And in terms of asking you to reach out, it really is, if something's kind of exciting to you and you want to do it, please don't feel pressured to have to take on a whole lot more new obligations, and really know that we're kind of all in this together. And I don't know any faculty members who don't care a lot about the well-being of their students. So do feel free to reach out if you are struggling.
Yeah, that's wonderful. Again, thank you so much. Very soothing, very inspiring. And I think that this mental health issue as raised by this person is definitely something that is challenging now, but as people who know at least a bit about public health, they know it can be even more damaging in the future, and in this losing this generation who just lose interest and even faith in research. So don't hesitate to reach out to these resources. Of course, the Student Working Group is there also to connect you, to get outside the box, think of ideas to get together. And I think this will just will snowball within the next few months. And before maybe closing, I would love to just ask a last question, and maybe given your profile, Jennifer, and your more recent experience, Roxanne, with media and policy, means we had a question about how might trainees turn to develop political acumen to complement our policy research training. So if you had something to say about that, and then we'll unfortunately wrap it up and get ready for virtually CAHSPR.
Well, I'll try and be quick so I can hand over to Roxanne. I typed actually a couple of suggestions into the chat. I think in addition to the ones that Alan suggested, the Health System Impact Fellow curriculum actually has some elements of that. And then you may also consider embedding in a setting. There's lots of places where you can walk a mile in those shoes, and there's no substitute for that in my experience. Roxanne, over to you.
Yeah, I don't know. I don't know if students have to develop political acumen to complement policy research training. I think students have to be strategic to jump on all the opportunities. But for my students, I'm not expecting them to develop political acumen. I think they have to be in the role of a mentor. As a supervisor, we have to accompany them, to show them the opportunity, and to be with them. So I'm not sure it's the role of the students. Ask your supervisor. You can count on of them. You can count on them. You can ask them. They are there for you, and they should help you in all the issue or all the opportunity that you could experience during your research project, and particularly in this world context with the pandemic. So I think don't hesitate to write to your supervisor, to ask help, and to write to your university, etc.
Thank you very much, Jennifer and Roxanne. And before maybe we close and summarize, Emily, Alan, did you wanted to add something to that question, or?
I'm good.
No. Okay. I am so sad, but it's 6:01 for me in Montreal. I think this has been terrific. I know I've personally learned a lot. Sorry, we're a bit past that. I think that it may be a bit cheesy, but I really stuck on that image of CAHSPR as a home, and I could see that throughout the conversation. We've built it a bit, this home, and we see that there's might be some foundations that are a bit fragile with academic performance benchmarks, the rise of private sector in taking advantage of public health systems gap right now, the difficulty, the equity issues of not only the healthcare delivery and public health interventions, but also health services and policy research opportunities and impact. However, there are wonderful windows that we've created, the ones with disrupting these traditional silos of having academics, patients, and policymakers, and health system impact fellows are such a wonderful example of that. And they're rising and multiplicating, and we love that. And also having, trying to learn how our governments and our policy communicators have come to apply research and data so rapidly in ways that are very informative, and what was our role, how could we enhance that and pursue that in the future, and in the way we train in our graduate and modernize our graduate programs. I really stuck on this idea of not adding value, adding value, not noise. So I think this was extremely informative. Thank you so much to our four panelists. Also a big thank you to the organizers of this webinar, Sally Clifford, Face-to-Face team, Maggie Restisi, our executive director, who you will see by this ton of virtually CAHSPR within the next 2 days. They have not slept in the last 2 months, I think. So hopefully they'll get some rest this weekend. And finally, I cannot be not auto-promotional, but just opening to all trainees that if you want to get involved and help the CAHSPR student working group, keep the conversation going, contact us at our email address. You can also apply for a co-chair position, and we'll see each other in Twitter tonight, tomorrow, within the next few days to get that, not lose momentum and learn amongst each other. So a wonderful thank you to our panelists. Have a good night, everyone, and stay tuned for the recording of the panel within the next 2 weeks on the CAHSPR YouTube channel.
A big thanks to you, Elizabeth, for all your work organizing this.
It was a pleasure, and definitely worth it.
Great job.
Thank you so much, everyone.
Thanks, everyone.